Hi YouTube, it's me, Justine. This is my 6-month post-op gastric bypass RNY video. As usual, I'm late. Sorry for the glare. I'll take my glasses off when I'm done reading. Okay, so I started my gastric bypass, or my big weight loss journey, on December 22nd, 2015. My starting weight was 286.5. I had my surgery on June 22nd, 2016 at Goshen General Hospital in Goshen, Indiana with Dr. Winston Gehrig. I was 267.2 or .4. On December 22nd of this year, my actual 6-month, which is also my year, from when I started everything, I was 198.2, so I actually got into Wonderland, and I did make a video about that. Today, January 3rd, I weighed 195 even. So, from my pre-op, I've lost 91.5 pounds, and from post-op, I've lost 72.2. I won't lie, I generally don't count from post-op, or I'm sorry, from pre-op, how much I've lost. I usually just count it all in whole. I didn't lose much in my pre-op. So, I guess we're just going to kind of get into this. I do want to add too, I am going to have a skin video, but because I have bounced around on what devices I've actually recorded things on, I'm going to have to download the Capture app back on my iPad so I can do a skin flick on it. Some things to talk about today. I guess kind of what's happened in 6 months. Bella, stop! Sorry, my dog's going crazy. A lot of things have changed. I'm a lot more active now. I don't get tired as much. I cross my legs. Right now I'm literally sitting cross-legged, and I can even do it in my car now when I'm not driving, and I couldn't even do that before. I used to, years ago, did meal prep, and I have not done that, but I actually kind of made that, I don't want to say more like a New Year's resolution, but I kind of made it as I do work for the school system and usually eat whatever the kids at the school eats. However, I don't want to eat things that they have at the school, only because there's a lot of things that have a lot of carbs in it, and I have a goal weight I would like to get to, and I feel like if I eat that, even if it's in moderation, I'm just kind of like setting myself up for failure. So, I did some meal prep yesterday, and what I did was I bought 3 chicken breasts, I cut them in half, and they actually worked out. There were a couple that were under 4 ounces, and there were a couple that were at 4 ounces. I cooked essentially 6 4-ounce chicken breasts, and I also did Brussels sprouts and roasted cauliflower. And I divided those into 6 containers. So those will be my lunches until I'm out of them, and I'll do some more. Dinner, I'm going to be cooking healthier options, you know, like my family and everything. However, today my kids want corn dogs. So they're going to get corn dogs. I'm going to eat one of my little lunch prep things. So I think maybe the meal prep thing will help. Another thing I want to add too is I really did stray away from like my protein shakes. So last couple of days I've actually really made sure that I've incorporated those in at least one a day. So today I had one of those, and I had some grapes. I didn't eat all the grapes. I really only had maybe like 8 or 9 grapes with it. And it took me about a half hour to do the shake. I mean, sipping it. I just can't straight drink it, so it's not, I'm not overdoing it. Anyway, exercise. Again, rough topic for me. I've not been exercising. I got a YMCA membership to exercise, and I have not. I've gone a couple times. I was super proud that I was doing the running app, and then I got busy. I got a second job, and I just didn't have time. So I am going to have to kind of come up with a plan on that. I live in Indiana, and it's really crappy weather right now, so it's not like I could just go running outside. And I also want to lift weights. Excuse me. So, I need to work on that for sure. One topic, loose skin. I have it, yes. Sorry, my husband is blowing up my phone. Allie, text your dad. Tell him I'm making my video. He needs to hang on. Sorry. So, does it bother me that I have loose skin? A little bit. I would rather have the loose skin than the full skin. Like I said, I can hunch over. I can find clothes easier. And I just feel a lot better than what I did being, you know, almost 300 pounds and not having loose skin. Does gastric bypass affect the family? Yes. I think it does, and it affects it for a lot of reasons. If we do choose to go out to eat, it is difficult because I'm, one, very picky about what I ate before, like as far as what I liked and preferences and food allergies. But I'm actually made one of my kids come in and she's going to help do a video with me. So, Allie, come sit. Cup spot, love. I know. This is Allie. This is my daughter, Allie. Okay. Good Lord, the dogs are savages. Okay. So, how has me losing weight affected you and the boys?
It hasn't really affected us. I mean, when you were at first, you didn't really want to do a lot of things, and that kind of affected us then. But now, since you've lost weight and stuff, then you want to go and do more, and you're a lot hyper, and you never want to go to sleep.
Okay.
Just being honest.
Okay. What about like food? Is dinner different now than what it was before? Or?
Yes.
Yeah.
It's a lot different.
You do kind of have to make changes as far as food is, and I mean, I don't really let you guys do pop. I didn't really much before, but my husband seems to be a little bit more slack in that area. Yeah. Dad likes to let him do the pop. I'm not a big fan. I do have a lot more energy, but sometimes like your old habits kind of creep up on you. Like I do like candy. Yeah.
You do. You have some on your desk.
Yeah, there's literally some in my desk drawer. I really do feel like I probably like candy more than I did before, which is kind of scary. But I do use it in moderation. One thing you wouldn't think of, you know, before I did all this, you would sit and you'd think, okay, once I do this and I lose weight, my life is not going to be basically controlled by food. That is a lie. Your life still gets controlled by food because, you know, like the kids, if they're hungry and I'm literally in a pinch, I can go to a drive-thru for them. Do I prefer it? No. Like, seriously, how many times have I let you guys have anything in a drive-thru?
For the past few years?
No,
like
probably,
recently?
let's say like last 6 months. Halloween, and I think when we went and took you guys to Grandma's.
And for cheer.
Yeah, and for cheer. So like 3 times in 6 months, where we were doing it like once or twice a week. I can't just go to a drive-thru and find food. I mean, I can. I just choose not to. I don't want to eat that stuff. I don't like how it makes me feel. I have no desire to eat it, and I don't want my kids eating it. So that's one big thing. Like Allie says, I do really like to make sure that we're not eating bad. I do probably spend a little bit more on groceries now, but I don't know if that's because I pack their lunches now, or I don't know, it could go a lot of different ways, because, I mean, I do eat less.
Spend a lot of money on the fruit and vegetables.
I do, and then that is my thing too. I like to snack on vegetables, but my kids do too, and they like to snack on fruit. So some of it I don't know if it's solely just because I've done this or not, but I can't say it has changed a lot in my like grocery budget. I guess kind of as an example, I was spending like $100 to $115 every week on groceries, and I spend anywhere from 125 to 150 now, but I do pack their lunches. So it's not really a huge jump, and I feel like if it means a better life for them and a healthier life for, you know, all of our family, then I would much rather prefer that. I do spend more money on vitamins now because I have to take vitamins. All in all, 6 months, the roller coaster that I've been on, where I'm at mentally right now, I don't think my mind is where my body is at. What I mean by that is, I know I gave you examples of things in previous videos that I think have changed, like how my clothes fit and stuff like that, but I feel like, and she can even vouch on this, I still don't really want to go look for clothes, and that annoys her because she was looking forward to that part. I worry about how I look in it, and because I have some loose skin on my stomach, I worry about if my pants can hide it. And usually I pull my pants up a little bit higher to kind of give that nice smooth look. It's not really even smooth, but whatever. So I am picky. I have like 2 pair of jeans I wear. One is way too big and one fits okay. I personally think they're too tight, like in the stomach, but they're not. Like mentally, I think they're too tight because I've always preferred things that were looser. I probably wear the same 3 to 4 shirts, don't I?
Yeah.
Yeah, my closet is literally like bare. I got rid of how many trash bags did we load up in Dad's truck? Like 2 or 3?
I was 3.
I got rid of a ton of stuff, and I did it in increments too. So I just tried to give them away. I did buy a winter coat this year, so that's kind of a novelty that I actually have a winter coat that fits.
It's bright orange.
It's like a marshmallow coat. But my mind, I don't think, is where my body is. And my sister-in-law, I don't remember if I said this in a video, she asked me at Christmas time if I would feel if I lost all the weight that I wanted and I had the skin removal and everything that I want to do and I looked exactly like I wanted to look, would I be happy? Answer, I do not know. I have never not remembered a time of being critical with my body. And as a mom, especially to a daughter, I have complained taking her shopping for clothes, listening to her complain in the dressing room when I do the same thing. Yeah.
You yell at me and I yell at you.
Yeah, it's our thing. Yeah. School shopping, we were in Justice. Oh my God, it looks so fat. 3 days later, I'm trying to find clothes. Oh, I'm so fat. She's not even close to being fat. She's tiny. It's definitely, it's a mind thing. I know before I used to mock why you got the psyche valve. I completely understand it now. You really do need to make sure that your mind can adapt. And it does take a while. And I mean, and my weight loss has actually slowed down. I don't want to say significantly, but it's slowed down. And I do think some of that is my food choices. I think I was snacking more than what I should have. And I think I was having more calories than what I should have. So, I mean, that's why I want to make more of a conscious effort too. I want to get to my goal weight. So, trying to decide what your goal weight is hard. I mean, I said 120 to my husband. He's like, are you sure? He's like, I don't think 120 would look right on you. I'm like, am I too high? Am I too low? And like, she's giving me that look.
You second guess yourself a lot.
I do, but he has a point. I've always had more musclier legs. So am I going to look weird? Am I going to look disproportioned? Am I going to look like a nut? I don't know. So I don't know how to know what to set my goal weight at. So anybody that's going through that, lend me a hand, because I don't know. I just know that I don't want to weigh more than 150 pounds. So I'm worried. I'm worried about how my thoughts are going to go with that. So Allie is here with me. If you guys have questions, message them and I can do another video and we can ask the kids kind of their thoughts on things and how it affected the family. However, I'm actually going to be making a secondary video to this. I'm going to do a skin flick. It's going to have my pre-surgery stuff and my today stuff. Please, no nasty comments on that video. It takes a lot to be able to strip down for YouTube and, you know.
The entire world see it.
Yeah.